Running a successful healthcare practice takes way more than just clinical experience. The business side can be overwhelming, and many clinicians just don't have the expertise or formal training in this area. As a healthcare business owner, how do you bridge that gap to make sure your practice thrives? In this episode that I recorded recently at Digital Health Festival 2024 in Melbourne, I speak with Hanya Oversby and Jason Borody, co-founders of Doceo Health. And in this episode, we talk about how we can address the need for business education and resources in the healthcare sector, the importance of a supportive network and community in driving the success of healthcare practices, and the evolution of Doceo Health from a boutique consultancy to a comprehensive membership platform. Collaboration starts with a conversation, Team Health Tech. Let's make it happen.
Welcome to Talking Health Tech, featuring content and community about technology and healthcare. We acknowledge the traditional owners of lands these conversations were recorded and pay respect to elders past and present.
Jason and Hanya, how are you?
Good, thanks, Pete. How are you?
Good. It's great to be here in the hustle and bustle of the startup village here at Digital Health Festival.
We are so excited. This startup bit's the most exciting bit.
Yeah, it's got a buzz to it.
It's got a great buzz. Yeah.
So I'm really lucky to be able to spend some time with you and seeing Doceo as THG Plus members and really understanding what you're doing. There's an exciting solution you're bringing to market, and it's available and got a lot of experience in healthcare, and I know this, but maybe set that context and tell us a little bit more about yourselves and your background, and then we'll go from there.
Oh, okay. Well, I've been in this business consulting space since 2001. So really, historically, have seen how businesses have changed in that time. So that's my background, and working with practices directly in business consultancy. So it's been really great. And Jason?
Well, I guess for myself, I grew up in a medical family where, my dad had to start up his practice and everything else, and so I experienced that firsthand growing up. And now working with medical practices to help them with business development, marketing, growth, getting new patients. I guess I've been doing that specifically for the last 16 years. And so now everything's really coming together, working with Hanya, working with all the other partners that Doceo has. Building this platform has just been really exciting.
Yeah, interesting. No, that's interesting hearing about, the consulting that you do and dealing with healthcare providers often one-on-one. You talked about a platform. Tell me a little bit more about Doceo then and what that is.
Yeah. Oh, who's going to go?
Well, I guess what we've built is every business solution on one platform. So we cover business services, we cover the knowledge base with not just with CPD and education, but also with forums and Q&A, both from a peer perspective, but also, we got the opportunity to actually engage with specialists in the fields of the different business services that the practices need. So whether that's lawyers or accountants or whoever it might be. So pulling all of that together into one platform, which learns about the different practices and what they need and how we can help improve efficiencies and that sort of thing, it's been terrific. And we're working with so many different partners.
Yeah.
That's really been exciting for me.
Well, I'd imagine, Hanya is what you would have seen through, the work that you've done, I guess, one-on-one with a lot of clinicians. You would have built up a good partnership network too, and understand that the importance of those experts to be able to help those healthcare providers.
Look, Pete, you've hit the nail on the head, and exactly why we've created Doceo Health. So Doceo Health is a membership platform, we're providing a scalable access to those years and years of knowledge of business tools, network partners, all the things that practitioners in a private setting need to help start, grow, or set up their practice even for succession planning. So really we're taking what we've always done and made it available and in a scalable format through this membership platform.
Interesting. And I'd love to learn a bit more. So, we're really talking to those that are owning their healthcare business, mentioned in private practice. And I would expect that going through medical school, they don't really throw in a business coach.
There is no MBA at they should have.
They should.
Yes, but look, what we found is typically you go through medical school, you graduate, and here in Australia especially, you need to set up your own business. So it's everybody that we work with starts at ground zero. And it's really what we're wanting to do is provide them access to information that they don't have to make things up. They can have access to information at an affordable price through their membership platform to know who's out there, what services should we be using. So really, I suppose that's what Doceo Health is about. It's connecting you with the right network partners, giving you access to tools that you can use yourself. They can even have access to us. Like, we as consultants are network providers to Doceo Health. What we're also doing is what individual practitioners don't get access to is opportunities and value propositions from network partners because they're single practitioners. But if you belong to the Doceo platform, we're on your behalf organising good deals and opportunities for you so you can have access to those as well.
Yeah, you touched on something that's important there in itself, because I was thinking, we're not short of PR companies, accountants, lawyers, whatever it might be, and like you could Google and find anyone that provides services. But I know front of mind for business owners, particularly in healthcare, especially if you're a clinician, when your core focus is actually providing care to patients, often the question isn't, do you know if one exists? It's, can you recommend a good one or one to work with in healthcare?
Yeah, and I think one of the things we need to remember as well, like we were just talking about the fact that business skills aren't taught when you're coming through medical school. A lot of the doctors don't want to run a business. Like they're there to help people. They're there to do what they've trained to do. So, I mean, what you're saying is absolutely right. So part of, I guess, the important thing of building the partnership network in Doceo is making sure that we've got specialised, accredited, vetted suppliers who all share the same vision of actually wanting the best for the practitioners, for the doctors, for the business owners, and also for their teams and their patients as well. You're right, there are a lot of providers out there who say they specialise in healthcare, but maybe don't have quite as much experience. So it's just a matter of making sure that we can get the right partners, the right people. And that's really what it hinges on.
And I think, Pete, that's exactly why we wanted to set this up, because so Russell Lee is the other director. He's not in this frame, but he's part of the Doceo Health founders and directors. Jason and myself, between us, we've got about 60 years experience in this healthcare industry. And with network partners we've used that are trusted. So Doceo Health isn't about just putting anybody who provides anything on that platform. We're saying, as Jason just said, these are people we've worked with or we know can be trusted. So we are happy to get these people introduced to you. But on top of that, actually...
Well, the forum's a big part of that too.
Oh, yes.
The forum's important because not only can you ask questions and have industry experts answer them, but you can also get the advice from other peers, people who have maybe, already gone through the challenge that you're going through as a practice owner or a healthcare business owner, and actually get their feedback as well, and even get opinions on other suppliers and different methods of doing things.
Yeah. I mean, that's something I find too, is that quite often a practice owner may not necessarily want to speak with a full-blown consultant right now. They just want to speak to someone who's one or two steps ahead, that's just like them, that's done something and understand what their experiences are, good and bad. And I guess what you're describing there is a community and a way to pull some of those learnings in a way that you couldn't otherwise do if you're having a lot of one-on-one conversation.
Yeah, and 100%. And I suppose what we're really wanting to do is work with amazing people in the community such as yourself. We're talking health tech in itself is, we know about you, isn't that great? But people in our network would go, oh, great, we didn't even know you existed, that you're talking about these things, and that there's a channel to go through another way to gather more information, to be more educated. And you've got network partners, and the reason we're all working together is because we love this space, we understand this space, and we genuinely love seeing what's happening. And healthcare is a dynamic and quick changing space at the moment as well, especially this digital space.
Yeah, I'd love to learn a bit more then about what some of those dynamic changes are that are happening in healthcare, some of those pitfalls or risks or challenges that clinicians are facing. It could be historical, it could be like something right now.
Well, from our perspective as business advisors and in that space, there's often commercial decisions that are made that it's not till you're 4 or 5 years down the track and you realise you need to be looking at your profit and loss, or you need to be looking at, it's not just the money in your bank.
Or structure or whatever it is.
How do you structure yourself to eventually sell, or whatever it is, to actually look at yourself as a business. Quite often, business that we come across will come to us at a point where they're saying, oh, I need some help. But what we're really looking at with Doceo Health is saying, let's educate you now. So rather than saying, I need help, we'll say, oh, I got to this phase, can you help me grow some more?
Yeah.
And there are so many changes at the moment. I mean, everyone's talking about, especially here at Digital Health Festival, everyone's talking about AI tools. Everyone's talking about how we can streamline processes, how we can add intelligence to processes. There are just so many opportunities now. And there have been a lot of other changes too, even, for example, from a compliance point of view and what you can and can't say in terms of websites and social media and promotion and other things. Like, there is just so much change at the moment in that digital space for health businesses.
Yeah.
It's just, there's a lot going on.
Interesting. I'd love to learn a little bit more about that partner network. I know you've built up those good quality relations over time, and you mentioned they're vetted and that they're, that's that trusted partners you work with. What's that process a little bit more like? Tell me a little bit more about that process of, bringing on those partners, what they might look like from their perspective that might want to speak to you. They might hear this conversation, think, well, hey, we provide these particular services for those in the healthcare space and would love to learn more about Doceo. What does that process look like?
Oh, that process is very, very simple. For us, it's reach out, talk to us and tell us about yourselves and what service you're providing, because of course we're not privy to every single service available in the network. So for us, we feel that being introduced to your services, see how it could fit into a private healthcare business in a healthcare setting, and then explore that with that service provider. And we've got a few of those that we've already spoken about when, we didn't even know that existed, or that's great. So we're excited because we're the gatherers of the information and what's the latest and greatest. We use our years and years of knowledge to say, well, how would that work? Would that benefit our clients? Those sorts of things. So that vetting's done through what we know a practice should need or want, and then bring it to our members.
And I guess the process in terms of working with us is quite simple as well. So Doceo doesn't actually charge anything for businesses to become partners, except for maybe a couple of categories where, we've had to work something out specifically. But typically it doesn't cost you anything to be a part of the program. We have a fairly simple sort of online tool which manages all the onboarding process and everything else. And then once you do become a partner, there's actually quite a bit of information that the platform then provides to partners about the members, about their businesses, about opportunities and that sort of thing as well. And also we've actually seen a really nice, level of integration between some of the different partners as well, where they're actually starting to work together and help each other in different ways, which is really great to see, because at the end of the day, it's everyone working for the benefit of the practices.
Yeah. The other thing that we're doing through Doceo too is what we found in our sort of bespoke relationship with clients. When we introduce them to a network partner, the client would have to go off and reintroduce themselves and what they're wanting to do. So with Doceo, we do have, when we onboard members or they would like to work with us more closely, we do a bit of data collection if they would like to. And at the clients, with the client's permission, if they're interested in a network partner, if they would like that to be shared, we can share that, but not unless it's agreed to by the client. But it just saves them to start telling the network partner about their journey from the beginning.
It integrates the process. It integrates the process and streamlines everything. So what it means is that all the different partners can work collaboratively for the benefit of the practice.
For the business owner,
Yeah, and it goes to your point earlier that not everyone necessarily wants to spend all their time niching down in a particular area and understand. To be able to partner with someone, to be able to make those connections can save a lot of time. And from a clinician's perspective, that's one thing that they could do more with, which is time. So,
absolutely. We always say, I do a lot of presenting, and the first thing I always say to all the practitioners is, more valuable than money to you is your time. So if you can actually find the right network partners or come to our membership platform or whatever it is to save you that time so you can do what you're trained for, you're ahead, which is fantastic.
Excellent. Hey, question without notice, because the both of you were lucky enough to spend some time in Dubai at Hanya and Health earlier this year, and that was a lot of fun. And I'm thinking about some of the challenges, and the topics that are front of mind for Australian business owners and clinicians in that private practice space. You mentioned, understanding what the navigating AI tools, and there's a lot of regulatory piece and stuff that needs to be done. Are you seeing that in other parts of the world there are similar challenges that healthcare business owners are facing, or is it a little bit different? Tell me about it.
Yeah, no, look, well, first of all, Dubai was amazing. It's a huge event, and it was just really interesting getting that global perspective. And I suppose for us it was interesting because we saw, as you were suggesting in your question, within the Middle East, we're certainly seeing a lot of the similar sorts of challenges For example, we were talking to some representatives from Saudi who were talking about the switch that's happening in their country from sort of more of your public health to your private health type settings. Within Doceo as well, we were involved in some events in South Africa recently as well. And that's just a whole other opportunity where we're seeing very similar challenges, but in a slightly different context. So it's just been really interesting to see how similar.
Interesting that you say that, because business is business. And even working with all our different clients in different modalities, they go, Hanya, have you worked with us before? We're interventional radiologists, or we're this. I go, well, 70% of what you need to do your practice is business. So that's all the same. So I think that's what Jason's referring to. It's a worldwide common problem.
Yeah.
How to run your business effectively with basic business principles.
Yeah, love it. And so then thinking about all the people that are coming by and having a chat here at Digital Health Festival, and we're only in the midst of day one right now, and I expect there'll be lots of conversations to have from you. What are you hoping that, what can people do to kind of learn more, or what are the types of conversations that you're looking to have here at Digital Health Festival and hopefully people take back to their thinking?
Yeah, I suppose here at Digital Health Festival, we're really having a lot of discussions with network partners. I suppose this particular festival, we're seeing mainly people with other types of businesses and looking to interact with other businesses, not so much with clinic owners directly or people who've got business owners. So at Digital Health Festival, it's really about interacting with us as other network partners and businesses. But we would love to speak to anybody. We're here, we're prepared to speak to business owners and how they can engage with Doceo. If you would like to become a network partner, if you want to become actually, we've got about 7 categories of Doceo partners. We've got lifestyle partners we're interested in talking to, education partners, technology partners, business service partners, colleges and society partners. Definitely, we're speaking to them as well.
No.
And also associate. What did we call them?
Associates.
Associateships as well. So really, anybody that's involved in this area, we've got something for you that we can work together with you.
Yeah.
I think one of the big things that I've noticed just talking to people here at the event is everyone's looking for, I guess, new or improved ways to engage with their partners, to engage with their clients and also to add value to their clients. As we've just been really interesting having some of those conversations with different people that are presented here, because they really see the value in how Doceo can help them do that.
Yeah.
And just even having some discussions about bespoke packages and bespoke services that we can actually work with them to put together in order to actually add more value to their customers. It's just been really exciting.
No, well, look, it's been, I can definitely understand the value there in terms of either from the service provider point of view or from the business owner or the clinician in kind of leveraging community and this kind of tricky landscape to navigate. So I appreciate you kind of sharing that. And it's great that Doceo is here, and we'll put the details for Doceo in the show notes of this episode for people to check out on our website as well as THG Plus members. So, Hanya, Jason, it's been great to have a chat here at the booth.
It's always great, yes, and log on to doceohealth.com. Come and join us, be part of our network. We'd love that.
Love it.
Absolutely. Thanks for that.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.